Okay, so now we're going to go over the soft tissue component of plantar fasciitis. So, if you remember, we want to make sure that we're not only addressing the area of complaint, but potentially some of the other areas that are a little bit more silent in terms of producing pain, but contribute to the pathology nonetheless. So, if we put some lubricant on the bottom of the foot here, remember this is where the plantar fascia is mainly going to run. Most people are going to complain of this heel pain right here, but we also want to put some up the calf a little bit here. We want to make sure that we're treating more than just the plantar fascia. So, get him all set right here. Now, what these tools are going to have, they're going to have a double bevel right here. And so we want to go in and you want to be essentially going to tissue tolerance or patient tolerance. You can start a little bit more vertical in the beginning where you're not applying a lot of pressure. You can start with the tissue in a shortened position, or we can go through and then just lightly work this area up and down. You can do short strokes, you can do longer strokes. I tend to like doing short strokes so that I can find the areas of problem where you'll start feeling more granules in that area. It might be a little bit more tender to the patient. And then once I find that area, I can now start controlling more specifically how much pressure I'm putting on. Okay? So if we get in this area, we find some areas here in his soleus that are causing some problems, I can change the pressure, and then I can actually have him actively extend his foot, and that's going to assist in relaxing the tissue because his brain is turning on the dorsiflexors of the ankle, which means that it has to kind of relax the calf to some extent. So that when we're getting in here and working on this, we're using neurology instead of just using essentially brainless soft tissue work. We've got to involve the brain if we're going to make any kind of long-standing improvement. So, as we're going through and we're doing this, we're looking to see what kind of tissue reaction are we having here. When you start getting the petechia and some redness and maybe some purple spots, we want to just kind of be careful, especially if it's on the first treatment, because we want to make sure that we understand how the athlete is going to tolerate the treatment. So if we get in here and we've worked the calf, we can go back in, we can check the passive length of the ankle, right? And then we can get up and actually get in on the Achilles tendon a little bit. You want to be very careful around the Achilles tendon, just because it's extremely tender to some people. And so you might just be careful and make sure that you're not hurting them, and then quickly get up around the calf. Now, around the heel. When we're in this area, I actually spend a lot of time around this calcaneus here, and I don't spend a lot of time just grinding where it hurts the most. Typically where it hurts the most is not where the problem is, so we want to make sure that we're addressing the areas both above and below it. So I might be in this area right on the calcaneus. Again, the plantar fascia actually extends into the toes, so if you want to generate maximal tension in the plantar fascia, you have to extend the toes. So we're getting in here and working on this heel, and I can work in both directions. Typically against the tension of the muscle, you're going to get a more pronounced effect, but I can get in here and work. And these tools are great because if you just do manual, like active release technique in this area, I find it very difficult to go through and actually generate sufficient tissue tension in the Achilles or in the plantar fascia right on the calcaneus. So the tools are fantastic for this because we can broadly address the soft tissue in the fascia here, right? And then we can also be addressing some of the more stubborn, rigorous tissue right here. And then once we're done with this area, we can just kind of work up and we can address the plantar fascia that comes all the way up here, extending the toes and just being gentle and working this area, and then I will work back towards the area where they're complaining, which is again right on that medial tubercle, the calcaneus. Okay? So this is kind of a simple introduction to plantar fasciitis. It can be a very, very stubborn condition. But again, there's never only a soft tissue component of it. There's always going to be some kind of functional instability component somewhere up the chain. Today we talked about the foot, we mentioned the hip, but it can go all the way up to the lumbar spine and potentially even farther up. So we have to make sure that we're using our functional testing, we're using our manual skills to go through and address and assess the soft tissue, trigger points, motion assessment, all of these things, so we can be addressing not only the physiological tissue that's dysfunctioning, but the functional cause that led to it in the first place.